Hi, I'm David with Arizona MMC, the state's premier medical marijuana certification office. Today I'm out in Fountain Hills, which is a beautiful city just outside of Phoenix. Gorgeous scenery, background. The topic is once again the monthly medical marijuana update for June 2012. A lot of great stuff has happened over the last month. The program is swimming along, and I'd like to bring you up to date on where things stand. In April of 2011, the program really got started. That's when they started administering the Arizona medical marijuana cards, and the certifications were allowed to be done. Part 2 of the program was the medical marijuana dispensary program, and that got put on hold when Arizona's governor sued the Department of Justice to obtain clarification over what could and could not be done with regards to the federal government potentially going after the state. Well, that rubbed a lot of people the wrong way, especially the majority who had voted for the program. It's no secret that state medical marijuana law does not jive with federal law. 17 states have now legalized medical marijuana, including Connecticut last month. So, at any rate, the feds dropped the lawsuit, they dismissed it, and then a Superior Court judge here in Arizona actually chastised the state for not going forward with Part 2 of the program. So now things are moving along. So between May 15th and May 25th, those 2 weeks, the state accepted applications for medical marijuana dispensaries. How many were received? 488. So a really good number came into the Department of Health Services, who is handling the whole program. So what they found is that there are 126 community health analysis areas in the state, and they're called CHAs for short. And basically they encompass population areas around the state, and that is where you have to decide where you're going to submit your application for the dispensary. So what they found is that 27, so 20% of the CHAs got no dispensary application at all. Most of those areas were not really surprising, except for a few. I mean, Paradise Valley here in the Phoenix area got none. Tucson West got none. Northwest Chandler. It's not a bad area, I would think, to do something, but, you know, none. So, and then some areas got a boatload. So like Estrella, who would have thought that would be a medical marijuana hotbed? That got the most at 16 applications. And they can only, the rule is that if the applications get approved, so if like 10 applications come in for, say, Tempe, I think Tempe, actually north of Tempe got probably 11, but let's say 3 of those get approved, they just have to put them in a fishbowl and just pick one out. It becomes a random process at that point. So 20% didn't get any submissions. The others got a lot. Some Estrella got 16. So it'll be interesting to see. The Department of Health Services says that it probably will take them a couple months to process through the applications. They'll go back to the applicants and say, okay, here's the problems, and they'll probably do that twice to kind of help them along. The goal of the Department of Health Services, what I'm seeing, is that they're not out to penalize or hurt anybody in this whole process. They're doing what they can according to the law, and I applaud Will Humble for doing his best with it. I mean, it's a tough situation, especially with the lawsuit filed by the governor. I mean, what is he supposed to do? When the first dispensary applicants came in, 8 months ago or whenever it was, he wasn't allowed to accept them. So, the rock, the hard place, that was just a problem. So, all right, moving along. So you got the dispensary thing going on. What happens when you're a medical marijuana patient and you're growing your marijuana and a dispensary comes in 15 miles away from you? Well, the law says that you can't grow anymore. You have to get your marijuana from the dispensary that's within 25 miles of your residence. Okay? A lawsuit was filed, and I'm pretty sure it was thrown out, of trying to go against that, but that was part of the medical marijuana law, is you can't grow anymore. You're not supposed to. So that is going to be an interesting thing, because 83% of people check that box on these applications that they want to grow. When they, so that brings us into the statistics. The statistics for up until right now have not been put out yet, but I have the statistics through part of May, and it showed that we're at right around 30,000 Arizona medical marijuana card holders in the state. So 2,000 to 3,000 a month, which I think is great. It's not too many. It's not, it's enough to keep the program moving along. I have a suspicion that when the dispensaries go live, those numbers will start to go up a lot more, because it will be much more systematic and regimented as far as how people get their, cannabis for their medication. They'll have a place to go. They won't have to go into a hydroponic store and grow their own, things like that. It'll just be easier, is what's going to happen. So statistic-wise, they really haven't changed very much. There's about 1,700 caregivers. About 87–88% of the cards are administered for chronic pain, and I've talked about that before. That is not a surprise. That is in line with Colorado. That is in line with California and other states. Because if you've had 4 failed back surgeries, or you have disabling rheumatoid arthritis, or you have really, really bad abdominal pain from inflammatory bowel, those cause chronic pain issues. So they get put into the sort of the bucket of chronic pain, and that's where sort of that fleshes out, in the diagnoses. And the rest have not really changed. 4 or 5% for cancer, HIV, multiple sclerosis, and things like. So that brings me into the next topic of discussion, which is a new study that came out recently from UCSD last month about multiple sclerosis. It's already an approved condition here in Arizona to get your medical marijuana card. But a new study was very compelling. They looked at 30 patients or so, randomized to whether they actually got medical marijuana versus a placebo. And the ones who got medical marijuana had a minimum of about 50% pain relief for the pain from the disease. And they also had very significant reductions in their muscle spasms. So this just goes along the lines of all the studies that have been done in the past, showing that it does work well for MS patients, better than a lot of traditional types of medications. So the next topic is looking at 4 new conditions that are on the table for consideration in Arizona. They are all mental health conditions. So it's PTSD, generalized anxiety disorder, migraines, and depression. So these are not new conditions as far as the world of medical marijuana is concerned. They've already been approved in various other states, California, Delaware, but not all 4 of them in one state. So on the last day that they were accepting applications for dispensaries at the Department of Health Services, they were actually having a big forum to look at these 4 conditions. So about 25 people got up and spoke. 23 of them were very much in favor of these conditions. 2 were opposed. So the forum went very well. Now the department has to look at research to try and back up these 4 conditions. And there is research out there to back them up. Is it big studies? No, it's very difficult with medical marijuana being a Schedule I drug to do those big types of research studies. Usually it's small studies, less than 50 patients is what they're able to do. Another thing that happened last month, there was a lawsuit filed to try and take away the requirement that medical marijuana dispensaries have a medical director. That was part of the law, okay? So that would be a big change, and it failed. Because a medical director, the Department of Health Services feels that it will help keep things safer, it will help give better education to the people working in the dispensary, as well as patients who have questions. And personally, I don't disagree with that. I think that it's a good idea. So that got thrown out or ruled against. So they do have to have medical directors just like that. There's your update. Things are going along well. I have a lot more for you next month with regards to how things are going with these applications, new statistics, and any new developments. Bring them to you here. I'm David with Arizona MMC. We have a toll-free number at 855-294-3227. The doctors at the clinic are licensed, compassionate, knowledgeable. They will do the in-person exam that's necessary, look at your medical records. The clinic will help get your medical records for free, take your picture, and help upload your application for your state card. Anyway, thank you very much for watching.